I'd like to welcome everyone who's applying to this program. You are applying to one of the best programs for internal medicine training in the country. Our value that we offer you is really understanding you individually and uniquely with regards to what your professional goals are, your aspirations, and your dreams.
At Jacobi, we emphasize supervised autonomy in our program. We give more autonomy to our residents than any other program in the country. We also emphasize research, and our residents have the faculties of Jacobi, Montefiore, and the Albert Einstein College of Medicine with whom to work. The autonomy and research opportunities are what help our house staff match into fellowships at impressive institutions across the nation.
I'm very confident that I will get great training here at Jacobi and graduate to be a very strong internist for multiple reasons. First of all, it's just how the program is built in general and how much stress is put on the education and on the training of the residents and how it's so central to everything. But then also the diversity of the cases that we see here, like whether it's the bread and butter of medicine, we see that a lot, and you're going to see it multiple times here to the point where you'll just become super comfortable with handling it on your own. But then you also see those cases that you read about in your books that you don't expect to actually see. You do end up seeing them here at Jacobi.
We've had a primary care track since 1982. So the first thing I want you to know is that by virtue of having a primary care track at Jacobi, the training that you will receive in ambulatory and primary care medicine is exemplary. The ambulatory care faculty is the largest single group of faculty within the department, and the majority of our faculty are graduates of our primary care residency training program.
So I came to Jacobi in 1997 as an intern and stayed on for my whole residency, and then was asked to be chief resident. And after completing my chief residency, I became one of the faculty attendings and have enjoyed a career here, moving up the ranks. Being at health and hospitals is probably the most rewarding place I could imagine working. Having the ability to work with our house staff and our residents and being able to give back to the next generation of learners and future physicians has been incredibly rewarding, and why I and so many of our faculty have stayed on for so many years.
Reflecting back on the past 2.5 years I've spent here at Jacobi, I can honestly say that I've grown so much, both personally and professionally. I work amongst one of the smartest residents from all over the world. I think our diversity is our strength because it allows us to learn from each other, not only by sharing our knowledge, but also our cultures and our experiences. And being located here in the Bronx, we serve a very diverse population where we are able to see a variety of cases and pathologies that we wouldn't really be able to see anywhere else.
I chose Jacobi because of the strength of the clinical training. Here at Jacobi, the main way we're learning here is by doing. So from day one here at Jacobi, you learn how to be a doctor as soon as you get here. The other reason why I chose Jacobi is because of the strength of the fellowship match. Every year we land in some of the most competitive fellowships and some of the best places in the country.
I came to Jacobi with the purpose of becoming something else, becoming more than just a physician. I came to become something more than the result of training, and I think I found this. At Jacobi, you're able to go very fast. You're able to learn so much from everyone at even places you wouldn't even expect. And you have very strong staff, and you have very good co-residents that will support you, and then you will just grow and become actually very autonomous when you leave here, and you'll be able to handle anything, as our chair says always.
We have a very robust cardiology division, and we are expanding our cardiology invasive services, especially over the next 6 months. We've been providing diagnostic cath for our patients over the last 10 plus years. And we also have a very robust endovascular program treating patients with peripheral arterial disease, venous disease, pulmonary embolisms, AAAs, and dialysis access in our cath lab. And that's something that our residents get exposed to and are participating in the care of those patients. And we really rely upon them to be our extension after the patients hit the cath lab to help take care of them. And I think it's very interesting to them. They don't get exposed to that a lot of many other programs, but here our house staff is very well versed in vascular disease and how to take care of it.
in order to be a strong internist or a strong clinician in general for that matter, you need to know not just what's written in the textbook, but what to do if the answer to your question can't be found in a textbook. If your problem is so complex or your patient is so complex that you can't just look it up on UpToDate or Google, and you need to draw upon your medical knowledge and experience in order to address that problem or that patient. And that's really where Jacobi stands out. That's the biggest strength of Jacobi, is that it provides us with, firstly, a vast amount of medical knowledge and understanding of the underlying mechanisms of disease, but also a knowledge of how to apply those principles to unique situations and unique patients, and to patients who may not only have medical issues, but socioeconomic issues to access to healthcare, and to be able to apply that knowledge and our training and experience to those unique patients, I think is something that really prepares us in an amazing way to be very strong internists.
Jacobi has a lot of strengths as there's different research opportunities that residents can easily get involved with. On the one hand, our relationship with Montefiore and the Albert Einstein College of Medicine allows us to collaborate with researchers at Montefiore and use the resources that we have at the Albert Einstein College of Medicine through a variety of multiple specialties and subspecialties, and really doing high-level, high-impactful research. There's also a new developing tool that we have, is that NYC H&H's new rollout of EPIC allows us to collaborate with all the other HHCs to have large system-wide studies, which is also another opportunity where you could get collaboration across different sites and have a very large patient population to have different research projects. And both of these are available to residents to get involved with, and even some to often take the lead and have their own ideas and see them to fruition.
Outside of work, the relationship between the attendings and the residents is very good. Everyone's doors are always open. Everyone is always willing to listen to how your day was. People care about how you've been doing, how you're handling residency. During COVID, New York was one of the hardest hit places. Jacobi was hit very hard, and while we were at the forefront seeing patients every day, it was very tiring. Our program director and our leadership spent multiple hours adjusting our schedules, trying to get us weekends off, trying to make sure nobody was on too heavy a rotation too often. And it felt good to know that even in a pandemic, even during an emergency, we had people who were watching out for us.
Just to focus on some of the things I think that make Jacobi a wonderful program, and if I had to go back and choose it all over again, I would choose this program as my first choice. I think one of the things are just the people. The group of doctors that I worked with and I graduated with are some of the most wonderful people to have trained with. Some of them are still my best friends to date. I think Dr. Goodwine and the rest of the selection committee does it every year, but they choose the most wonderful group of people to be part of this program.
Well, it's the most diverse setting I've ever been in, and it's certainly the most diverse group of individuals I've ever worked in. You have graduates from the US, you've got graduates from foreign medical schools, and all of them are just amazing. They have such tremendous backgrounds. It's really a pleasure. You see, you're not just future colleagues, or the residents aren't just future colleagues. We're colleagues now. We are both teachers and learners here, and we're working together. We collaborate, and we support each other to take care of the patients and also to help you with your education. You see, it's a large program, but it's a close-knit environment, and it's about relationship. And when people leave Jacobi, they feel like they're leaving family. They come back, and we love to keep in touch. It's what makes Jacobi great.
Basically, if you're looking for a home away from home and you're looking to be this strong internist that can tackle whatever case is thrown your way, you definitely need to come to Jacobi.